And welcome to today's webinar. Today we are in part 5 of our Reducing Your Risk of Heart Disease webinar series, and our topic for today is controlling risk factors for women. This webinar series is brought to you by Mended Hearts and the ASPC, which is created from an educational grant from Amgen. All attendees at this time are in listen-only mode. Please note that at the end of the presentations, we will have a question and answer period, and you will have time to ask your question in 2 different ways. One, you can type your question into the chat box, which is located on the right-hand side of your screen. If you type your question in, it will alert me to the question and I will read it to our presenters. The second way is you can raise your hand, which is also located in the box on your right-hand side. It's a little hand, and if you click that, that alerts me that you have your hand raised and you would like to be unmuted to ask your question. Once it is your turn to ask the question, I will unmute you and give you the ability to ask the question. Thank you again for attending these webinars. They have been very insightful, and I feel like this one is going to be the same. The presenters for today is myself, Andrea Baer. I am the moderator. I am the Director of Patient Advocacy and Program Management for Mended Hearts and Mended Little Hearts. I'm also a mom to a 10-year-old son with congenital heart disease. Joining me today is Caroline DeRichemond. She is a member of the American Society for Preventive Cardiology. Caroline is a cardiology nurse practitioner in the Geisinger Health System in northeastern Pennsylvania with a special interest in preventive cardiology. Donnette Smith is also joining us. Donnette is the president of Mended Hearts. Donnette was born with a congenital heart defect and has been actively involved in Mended Hearts in a variety of roles over the past 20 years. Donnette is a passionate advocate for women's heart health and access to care for everyone. Before we get started with the presentations, I just wanted to give a few moments to go over about Mended Hearts and the American Society for Preventive Cardiology. Mended Hearts is the largest peer-to-peer support network in the world, and our mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. We have 285 chapters across the country, serving 460 hospitals. The American Society for Preventive Cardiology's mission is to promote the prevention of cardiovascular disease and advocate for the preservation of cardiovascular health and disseminate high-quality, evidence-based information through the education of healthcare clinicians and their patients. And with that, I am going to turn it over to our first presenter today, Caroline DeRichemond. The floor is yours.
Thank you very much, Andrea. And good afternoon, everyone, and welcome to today's webinar on controlling risk factors in the prevention of cardiovascular disease in women. Despite significant advances, Andrea, if you could go back a slide, please, for a minute. Thank you. Despite significant advances in the management, detection, prevention, the procedures, and medicines in cardiovascular disease, despite all of these changes, cardiovascular disease remains to be the #1 killer of women in the United States of America. With that alone, over 500,000 women die each year from some form of cardiovascular disease. This translates to approximately 1 death every minute. 2/3 of women will die suddenly with no previously recognized symptoms, and it's essential to prevent cardiovascular disease. So what do? You are taking the first steps by joining us on this webinar today. I recognize that many of you already have a diagnosis of cardiovascular disease. Some of you may be supporting someone with cardiovascular disease, and other of you are here to join us today to learn your own personal risk factors for cardiovascular disease. The information provided for you today is something you can share with your mother, your daughters, your nieces, your granddaughters, and your gal pals. On the next slide, This is a picture of the brochures that were given out at the first symposium for women that the American Heart Association held in 1964. I was 5 years old. It was entitled Hearts to Husbands. And as you can see from these brochures, it was to teach women how to care for their husbands after a heart attack. It has taken within our lifetime to debunk the myth that cardiovascular disease only occurs in men. Indeed, it does occur in women. It is the #1 killer. It has taken over the years, the American Heart Association doing surveys that in 1997, only 30% of people really knew this. And in 2009, half the people they interviewed knew that cardiovascular disease was a disease of women. In the United States this year, between the ages of 35 to 54, there's an increase of cardiovascular disease, mostly due to obesity. What happens is when people become obese, comorbidities such as hypertension, diabetes, sleep apnea, cholesterol problems, these are all mounting risk factors for cardiovascular disease. On the next slide, this is the most current recommendations by the American Heart Association for the reduction and prevention of cardiovascular disease in women. This was published in 2011. There are 3 categories there: high risk, at risk, and ideal cardiovascular health. I'm going to go on the next slides and go through each one of them so each one of you can understand your personal risk for cardiovascular disease. Those that are high risk, having one or more of these conditions, first being coronary artery disease, whether you've had a heart attack, you've had open heart surgery, you've had a stent, or if you've had a stroke or carotid artery disease. The carotid arteries are the great vessels that come off the heart and feed the brain. If you have peripheral artery disease, which is blockages in the legs, there are a lot of studies to note that peripheral artery disease is very under-recognized in women. So I suggest when you see your providers, ask them to look at your feet, look at the pulses in your legs. Many times we see women who smoked since they were young girls, even as early as the age of 40, where the aorta, which is the tube that comes off the heart to deliver the blood to the body, that they'll even have blockages of that aorta for their years of smoking in their younger years. Very important to make sure that you have an examination of your legs when you see your providers. Chronic kidney disease. Chronic kidney disease, we know that approximately 55 to 60% of women after menopause will develop this. Will you see this? No. You'll continue to go to the bathroom and urinate. But what happens is there's a change in your renal function, your kidney function on your lab work. When you see your provider, ask how your kidneys are working, if they're doing well. There are 5 stages of chronic kidney disease. The highest is when you would need dialysis. Most what we see are women end up with this earlier stage that does not require dialysis. What can you do? We don't have a magic pill for this, but I can tell you one thing. You need to avoid medicines such as Aleve, Advil, ibuprofen, and I just heard a few of you fall off the chair. These are drugs called non-steroidal anti-inflammatory drugs. They're very good in the right person, but if you have any of these problems right now, you should not be taking them because the chronic kidney disease can progress in taking them. They are not prescriptive. There's no warning there. The answer is Tylenol, and if you need help beyond that, please see your provider. Next on this list is diabetes. Diabetes is a major risk factor for development of cardiovascular disease. If you are pre-diabetic or diabetic, work with your provider controlling that as best you can. The hemoglobin A1C marks how your blood sugar has been over a 3-month period, and it's important to keep that under control to avoid cardiovascular disease. On this last section, the Framingham Risk tool is a calculator that we have to look at your personal risk for the next 10 years ahead. This is based on age and gender, and yes, women get an extra point. Presence of diabetes, your total cholesterol, your HDL, which is your healthy cholesterol, if you smoke or not, and your systolic blood pressure. It will give us a percentage of approximately your risk for a cardiovascular event over the 10 years forward. When you see your provider, you can ask them to do the Framingham risk score for you. Going to the next slide, this is the at-risk category. And again, you need to have one or more. Cigarette smoking, I know all of you are very informed that this is a problem across this country. It's such difficult to break this habit, as many people have been smoking since they were young. This triggers and generates changes within the vessels that can lead to cardiovascular disease. Poor diet. People should have 3 meals a day. Half the plate should be fruits and vegetables. A quarter should be starch. A quarter should be protein. And we'll talk about this a little bit later. 4 to 6 fruits and vegetables a day. I find people having no vegetables, no fruits up here in northeastern Pennsylvania. Lack of physical exercise. It is recommended that you have at least 30 minutes of exercise. If you have other problems that keeps you away from doing that at one sitting, you could do 15 minutes at a time or 10 minutes at a time. Some people will walk their dog. I encourage people to walk with their family. When you see your provider, ask them to calculate your body mass index. We are considered obese when that is above 30. And you want to see how that trends over time. If you have a family history of heart disease or vascular disease, and quite often in our clinic we ask about this, you'll find that many of them are smokers, but we want to know about folks that have had this prematurely, especially under the age of 55. Very important for folks to have this known to their provider so they can keep a close eye on them. Lupus or rheumatoid arthritis, these are both referred to as autoimmune disorders. And these are changes in the vascular beds that we find when folks get into their 40s. They are very prone to changes that will lead to cardiovascular disease with them. The next one in this at-risk category is the pregnancy complications. And many of you on this call today may not have known this. If you had one of 3 conditions during pregnancy, the development of high blood pressure or diabetes during pregnancy, or delivering a preterm infant, or having what they call preeclampsia, where you hold fluid and you're quite hypertensive before the baby is born. These are considered pregnancy complications that tell us at that time that these women will be prone for cardiovascular disease development when they become in their 40s, 50s, and 60s. There are some people I have in my clinic that had preeclamptic pregnancies that have had strokes up 5 to 7 years later. They can have a stroke after having these pregnancy complications. Many of you on this call may have cardiovascular disease, and all of a sudden I'm saying this and you're thinking, oh, I did have high blood pressure during pregnancy. Women that have these complications after they're done with OB should be followed by a provider. There's a whole algorithm how to monitor so that they don't develop diabetes. 60% of women that have these problems will be diabetic in their lifetime after having diabetes during pregnancy. The last bullet point on the at-risk category is the metabolic syndrome. And this is something your provider will look at your triglycerides, which is part of your cholesterol panel, if they're greater than 150, or your HDL is less than 50 for women. Also, the waist circumference. For women, it's less than 35 inches is acceptable. If it's greater, it's a point for being considered to have metabolic syndrome. Your blood pressure should be less than 130/85. If it's higher, it could be considered, and also greater than 100, your blood sugar fasting. So you have one of these conditions. If you have 3 or more, you're considered to have metabolic syndrome. So it's the waist circumference greater than 35, a change in your cholesterol panel, a high blood pressure, and a fasting blood sugar greater than 100. On this next slide, this is the last category in the current recommendations, which looks at the ideal cardiovascular health. Tragically, only 1% of women in the United States fit into this category. Blood pressure less than 120, not requiring medications. The total cholesterol less than 200, not on medications. Fasting blood sugar less than 100, not on medications. The body mass index less than 25. Non-smoker or quit a year prior. There's a formula here for your physical activity. Moderate or vigorous or combination, but essentially if you can get at least 30 minutes most days of the week at the most of your capacity, that's what's going to be helpful. And also as far as your diet, fruits, vegetables, whole grains, high fiber foods, especially having fishes that are cold water fish because it gives you fish oil. The pregnant women need to avoid that because of fish have high mercury levels. Limit your saturated fats, avoid the trans fatty acids, watch your cholesterol, avoid alcohol, watch your sodium. You know, when I was young, my mom cooked everything. Now, sodium is in everything, even in some of the cereals. Things like Chinese food, barbecue sauce, pickles are loaded with sodium. And additionally, sugar. Sugar is a big problem. There's a city here in Pennsylvania that has a tax on sodas with sugar in them to avoid people having exposure to this over time. One of the things on here I want to say to you is that make sure you have a cholesterol panel in your lifetime. 75% of women have had a pap smear and only 25% have had a lipid panel. On this next slide, it looks at eating heart healthy. These are the interventions. These are the ways to control your risk factors as far as eating healthy. A diet with fruits and vegetables. We look to 4 to 6 servings combined in one day. Adding whole grain whenever you can. High fiber foods. If you're with a family where they only like white bread, there's now breads that contain high fiber in them that are white bread. Having the fish twice a week or more, preferably that oily fish to get the fish oil. Watching that sodium content. I often tell my patients, don't clear out your cabinets. Take one product at a time and compare labels to see which one has the lower sodium content. Limiting the saturated fats, avoiding the trans fatty fats, watching the cholesterol content, avoiding alcohol, sodium, and sugar. Eat less than 150 milligrams of cholesterol per day. And for women, no more than 1 alcoholic drink per day. And no alcohol is best. Next slide. We've talked about smoking, but I want to stress with you, not only cigarettes, but these vapes are not controlled by any governing bodies. They can contain God knows what and cause more harm to your health. Chewing tobacco is just as dangerous as cigarettes. And there are some women that smoke cigars out there. And believe me, 1 cigar is the equivalent of 1 pack of cigarettes. Try to avoid environments where people smoke. Many states have put laws into place that people cannot smoke in restaurants now and some other public places. If you need to quit, get a family member or a friend because it's shown that they can successfully do it. Counseling is not always affordable, so that's why I defer to trying to get a buddy to do it with you. Nicotine replacements are good. There's gums out there. As long as you don't stay on a long time and they just bridge you, but refer to your provider to see what's best for you. There are some pills out there. And there's also most university medical centers will have a formal smoking cessation program. On the next slide, We talked about this earlier, getting the 150 minutes of moderate exercise a week, which is just brisk walking. And if you can get more higher intensity, that would be good because that gives you more cardiovascular benefits. And you space that out over the week, 5 hours total, with 2.5 hours of vigorous or muscle strengthening greater than 2 days a week. If you're trying to lose weight, the way to do it is try to get 80 to 90 minutes a day of moderate intensity. You don't have to belong to a gym. That's the brisk walking that will provide that for you. On the next slide, if you have sustained a cardiovascular event, quite often they will offer you cardiac rehabilitation program. If it is affordable, as I have found many of the insurances now charge a copay that makes it not affordable, please go. It's a time that you'll be on the monitor, you'll be exercising, they'll check your blood pressure. It gives us an opportunity as providers to tweak your medicines to make them just right for you. And not only that, you will meet other people who have gone through similar circumstances at the same time you did. And also it'll get you in an exercise program. It'll also let you know that when you go out in the real world again, that you can do something like a heavy laundry basket or those such things, or the dog takes off. You know you can run after the dog. On the next slide, this is the most important slide now that I've gone through this. This is something that your provider will most probably have in the office, or you can take this slide with you. They can write down your particular blood pressure. You should be 120/80 or less. The total cholesterol should be less than 200. The bad cholesterol for people without cardiovascular disease should be less than 100. For those of you with cardiovascular disease, it will be less than 70. Your HDL, which is your good cholesterol, they're like Pac-Mans that eat the bad stuff and bring it back to the liver for processing. They should be greater than 50 in women. The higher, the better. The triglycerides that come from everything we know and love, cookies, candies, baked goods, pasta, booze, they should be less than 150. So they are your cholesterol numbers that should be your goals. Glucose, the hemoglobin A1C less than 7%, especially those of you who are diabetics, biggest risk factors for cardiovascular disease that you need to work on. And the BMI we talked about, the body mass index being 25 or less, and your waist circumference, 35 inches. Why? Because women that tend to have a thick waist, we see more of these metabolic problems that lead to cardiovascular disease. So that ends my portion, and I'll turn it back to Andrea.
Thank you so much. That was a lot of great information. So what I'm going to do now is turn it over to Donnette Smith, and she is going to give the patient perspective on women's health, and then we will go into our question and answer period. Donnette, the floor is yours.
Thank you, Andrea, and that was incredible, Caroline. Thank you so much for those important notes on how to take care of our health. My story starts with being born with a bicuspid aortic valve, which means that my aortic valve had 2 leaflets instead of 3, and so it eventually turned into aortic stenosis, which was I had to have surgery for, and I did so. This slide that you see, I was asked recently to testify on the Senate Committee on Aging with Senator Susan Collins from Maine. That was an incredible experience. They are very interested in people getting access to care, and they're working very diligently on that. So I had the opportunity to testify on the patient's behalf in front of that committee, and it was really a great opportunity to let the lawmakers know exactly what we're dealing with as far as access to care and access to the medications that we need. In my particular area, it was the PCSK9, which was for high cholesterol. So it was great to be able to get the word out on behalf of the patient. Next slide. The heart facts for women, and of course, Caroline covered those so beautifully. Heart disease is the leading cause of death for women in the United States, killing 289,758 women in 2013. And surprisingly, maybe or maybe not, that's about 1 in every 4 female deaths. Now, I know for a fact, I've had several friends who back in the day, before there was so much information out there about women's health and the difference in their heart attacks or feelings when they have heart issues. So it's important for us to know that heart disease is the leading cause of death, and that we have made great strides in the past in acknowledging that women are at risk for heart disease, and that when they're presented to the hospital with a jaw pain, it's just as important, or maybe more so, than when a man shows up with a typical chest pain. So it's important to know that women have different symptoms with a heart attack than men do. So if you go to the hospital with any type pain that's different for you, you know it's different, then by all means insist that you get immediate attention. So you have to be your own advocate in that category and make sure that they do, because I've had several friends who in years past, before this was really known, would go to the hospital with a shoulder pain or what they thought was a really bad toothache or an earache, and were dismissed and told to go home, given maybe something for their quote unquote nerves, and go home and die of a heart attack. So, we've made great strides in that, and for that I'm extremely grateful. Despite increases in awareness over the past decade, only 54% of women recognize that heart disease is their number 1 killer. Of course, we as women think that breast cancer is the number 1 killer, and we get really excited over, making sure we get our mammograms, making sure that we have our doctor's visits and get our breast exams, so that we stay ahead of the issue of breast cancer, thinking that that's really what we have to fear. That is not the case. That is not the case. So the number 1 killer is definitely heart disease, and we need to get just as excited over that and making sure that we take proper care of ourselves as we do with breast cancer. We really get excited. I've been to many, I'm also a breast cancer survivor, by the way, and I go to a lot of the breast cancer runs, and they get excited about, we've survived, we've made it, and, they're jumping up and down, hugging each other and high-fiving, and so excited to still be alive. But yet women with heart disease don't pay that much attention to it, and that frightens me, because it's just as important. We need to be excited about it. And yes, I know that it's difficult to do all of those things that are needed to keep our hearts healthy, like eat a healthy diet, exercise. We have to work at it. We really do. And I think that may be a hindrance to us because as women, we're extremely busy with family and probably jobs as well. So it's difficult, but we do need to pay attention to that. Also, heart disease is the leading cause of death for African American women and white women in the United States. There again, we need to be on top of it. We need to be sure that we get our hearts checked and eat properly and get that exercise. About 5.8% of all white women, 7.6% of Black women, and 5.6% of Mexican American women have coronary heart disease. Almost 2/3, or 64% of women who die suddenly of coronary heart disease have no previous symptoms. And that's another fact that we need to pay attention to. You can have a heart attack and not have the typical, chest pain that you see on TVs and movies. It's not quite that way. So if you have the slightest something different going on with your body, if you just don't feel right, then get that looked at. Next slide. The risk factors are for women, of course, and Caroline covered these so beautifully, is diabetes. Women with diabetes are at a greater risk of heart disease than are men with diabetes. Mental stress and depression. Women's hearts are affected by stress and depression more than men's. And goodness knows, women have, especially mothers, have a lot of stress on them, taking care of family, making sure that your family eats healthy. I know when I first started my life with knowing that I had heart disease, I cut all the fast foods out for my house, and I had kids in school, high school then, and we had fish 3 times a week, and they even made a joke about, Mom, if you feed us any more fish, we're going to grow gills. But it's something that we have to be aware of, so it can lead to stress and making sure that everyone's healthy. Smoking. In women, smoking is a greater risk factor for heart disease in women than it is in men. So if you're smoking, please stop. It's dangerous, it's not healthy, and it's important that you stop smoking. Inactivity. A lack of physical activity is a major risk factor for heart disease, and some research has found women to be more inactive than men. Of course, we have busy lives. We're taking care of family. We're working a job outside the home, plus keeping up with housework, and if you're like me, mowing the grass and cleaning the gutters and that kind of thing. So we've got to make sure that we make time for ourselves and do some healthy exercise, and not just when you come in from work, plop down on the sofa or the recliner and take it easy. Although that is pretty exciting to be able to think of doing that. Menopause. Low levels of estrogen after menopause pose a significant risk factor for developing cardiovascular disease. I was not aware of that until I started getting involved with Mended Hearts and learned the risk factors for women. I knew that the estrogen levels were lower after menopause, but I didn't really understand the importance of that until later on in life. So make sure that you're aware of that. The broken heart syndrome. This condition, often brought on by stressful situations that can cause severe but usually temporary heart muscle failure, occurs more commonly in women after menopause. This was also a new one to me. I'd often heard, they died of a broken heart, but it can actually happen if you've had a stressful situation, which is a death in the family, something traumatic that has happened. It can really play a factor in your heart condition. So please be aware of that. And the next one is something that's really on my radar, and it's certain chemotherapy drugs and radiation therapy for cancer. Some of these chemotherapy drugs and radiation therapies can cause heart issues. And to push that point home, my youngest sister at age 33 was diagnosed with breast cancer. She went through chemotherapy. She went through all sorts of treatments to make sure that she was alive to take care of her 3 small daughters. And at the 10-year mark, when we normally think, okay, we've made it to 10 years, we're good to go, she developed a mysterious illness, and she was a registered nurse, by the way. So at age 44, she's developed heart failure, unbeknownst to her or us. And we discovered that it was because of the chemotherapy drugs that she had taken during her treatment for breast cancer, and she passed away at the age of 44. So be aware of that, and it's not just for women; it can affect men as well. So can radiation. My breast cancer was treated with radiation, and I asked questions at the beginning of, is this safe for me? My surgeon assured me that it was. Well, in the years past, 9 years ago actually, my mechanical valve started failing, and no one could understand why. And it was because of the radiation damage to the vessels that had caused my valve to clot closed. So be aware of that and ask questions. And my suggestion would be, if you're going through chemotherapy or radiation treatment, then ask to be followed up with a cardiologist after you're finished with your treatment. Super important, super important. Pregnancy complications, high blood pressure or diabetes during pregnancy can increase women's long-term risk. Women with inflammatory disease such as rheumatoid arthritis or lupus may also have a higher risk of heart disease. So if you have any of those, please be aware of that and ask questions of your doctor. Be your own advocate. Ask questions. Be sure that you understand everything that's going on before you leave that doctor's office. I know they're busy. I know they don't have time, but be sure your questions are answered. Next slide. As we talked about earlier, a real heart attack may look and feel different for women. Women are more likely to have non-traditional symptoms of heart attack than a man does, and women are more likely to have silent heart attacks. So be aware of that. It could be something you think you might have a toothache. You could think your face could be hurting on the side that you think might be sinus infection, a jaw pain that's really hurting, your neck, shoulder, even, and of course in the arm. Just be sure, or in the back. There's also some who have presented with pain in the back. So any symptom that you're having that is unusual, please go to the ER or see your cardiologist. Women are more likely than men to have different symptoms of heart attacks than the chest pain and discomfort. And some of these are, as we talked about, pain in the back, neck, jaw, or throat, indigestion, heartburn, nausea or feeling sick to the stomach, vomiting, extreme fatigue or tiredness, problems breathing, if you have shortness of breath, if you once could climb stairs with no issue and now you have issues doing that, if you get short of breath, please have that checked out. Women are more likely than men to have heart attacks that do not show obvious symptoms. These are called silent heart attacks. Those can be deadly. So please be aware, please talk to your doctor and make sure that you understand what's going on with your body. What you can do to reduce your risk, of course, is to please stop smoking. If you are smoking, please stop. Exercise regularly, even if it's just going out for a walk, please do that. Eat a heart-healthy diet, and I know that's hard, and I've had, especially the underserved areas and the underprivileged areas, I had one lady tell me, I can't afford to eat healthy. I know I should feed my family healthy foods, but they're expensive, and they really are. But it's important that we do that. And her example was, when she was telling me this, was, I feed my family. Our typical meal at night is a bowl of macaroni and cheese because that's all we can afford. That's frightening. So make every effort to eat a heart-healthy diet. Maintain a healthy weight, of course. Take care of your mental health is extremely important. I encourage you all to do that, and hopefully we can live long and happy lives. Next. Okay, thank you very much. I appreciate your attention.
Thank you, Donnette. That was great. I appreciate that. So before we go into the question and answer period, I just want to remind everybody that our last webinar in the webinar series is in 2 weeks on June 20th at same time at noon Eastern time. And that one will be on controlling risk factors for diverse populations. I want to again thank both of our presenters for being a part of this series. I have learned a lot myself. We have some questions in the queue, and I am going to work on going through them. Again, for everybody listening, if you have a question, please write it in your chat box, and I can answer or I can read the question aloud, or feel free to raise your hand, and I will unmute you so that you can ask your question. So one question here is, what are sudden coronary artery dissection and broken heart syndrome? Are they more common in women? And how do I know if I'm at risk for these things? I know, Donnette, you covered just a tiny bit, but maybe Dr. DeRichemond, one of you guys can elaborate.
I'd be more than happy to help you with that, because I deal with that on a regular basis with my profession. Very good question, by the way. So SCAD is the mnemonic for this sudden disruption of the vessel, and actually what happens is the layers of the vessel just kind of rip apart, and it is a very serious thing that unfortunately I've had the experience of taking care of a few people with that. how do you know? Unfortunately, there's no genetic testing at the present time, but it is a very serious event, and quite often we see it surrounding pregnancies and later. There are some people that are diagnosed with this problem earlier, that the vessels are not normal. Usually it's the kidneys that comes up in first. So therefore, those folks need to be watched very, very closely. And believe me, there's an association for people that have survived this. There is research going on about it, and unfortunately, we don't have an exact answer for that, and that was a good question, though. And the other one was about broken heart, Andrea, correct?
Yes, that's correct.
So what happens is, with stress, we shoot out a lot of hormones, and with those hormones or neurohormonal receptors that come about. Extreme circumstances, such as the death of a spouse. We had somebody here last week, her daughter died of a heroin overdose. There's an extreme emotional component to it. It's not that it is a mental illness. And what happens is the squeeze of your heart, of the master chamber, the ventricle, we call that the ejection fraction. No one gets 100 in that. The normal one is around 55 to 60. Gets impaired. It gets down less than 25 quite often. And what happens is you develop heart failure. And what happens is, because of the heart failure, you may have fluid in your legs, fluid in your lungs, where you can't lay down at night or sit up. When I've done some of my community talks, I often tell people of a certain age group, keep alert for your friend that's undergone a sudden tragedy, loss, because this is more common than people know. Both of them very, very good questions, and I hope that's a little more informative. Especially this broken heart thing needs immediate attention, not I'll get a doctor's appointment in 2 weeks, to the hospital to be assessed.
Great, thank you. I think this next...
I'm sorry, Andrea. I should say with the broken heart, I apologize. We will do heart catheterizations to make sure there's not another cause. And once we know that, we know about that, medicines will correct this. And the squeeze of the heart will be repaired with medical support, but it'll mean lifelong medicines. Thank you.
Great, thank you. That's fabulous information. The next question I think would also be directed to you. It says, I've read the following a heart healthy lifestyle can also help prevent Alzheimer's. Is this true?
That is very true. In fact, there's some information that came out on diets, which unfortunately we don't have a full time to talk about diets. But when you look at the diets that are available out there, DASH is the Dietary Advances to Stop Hypertension is one. Dean Ornish is a diet that was popular about 25 years ago. It's made a resurgence. We also have the Modified Mediterranean. They all have the same thing combined, and it's the healthy eating. And especially more that we learn about Alzheimer's, it's some of the vitamins we get from the healthy diet. And that's the key overall for everything. The way to live without cardiovascular disease is through a healthy diet and being active most of our lives. But yes, that's true. Some of these legumes and those things that give us some vitamins can prevent, at least help, with Alzheimer's.
Great, thank you. Okay, so this question is it true that women are more likely to die of a heart attack than men are? And if so, is it because of underdiagnosis, less effective treatments, or something related to being female?
Donnette, I'll be glad to take that, but I feel like I'm hogging the session here. Is that okay with you if I do this?
No, that's fine. Please go right ahead.
Okay. Now, the most important thing I need everyone attending here today is to take home, know your risk factors. That's the bottom line with this. I had a woman come in yesterday, 70 years young. She looks like she's 55 because she eats well, she exercises. Here she had a serious cholesterol problem. That lousy lethal cholesterol was greater than 200. More than one person in her family died before the age of 45 from sudden death. Know your risk factors. Is there sudden death in the family? Is there a cholesterol problem? Get yourself a cholesterol problem, your blood pressure, the things we talked about. It is very true that the majority of deaths in women are often fatal because 2/3 of the women with those sudden deaths have no previously recognized risk factors or ignore their symptoms. There are studies out there that show that women will be the first one to call 911 for somebody they're in the company of who's having a heart attack, but yet they can't sit down and talk about their own risk factors. That case I just gave you is a perfect example, and I hope that helps you.
Thank you. Donnette, would you like to add anything to that? Because I think that you hit on that a little bit in your talk about women not taking care of themselves as much as for men.
Absolutely. She's absolutely right. I mean, women, we're the caregivers. We're the ones who take care of the rest of the family. So we tend to push our illness, if we, if we're even aware if there's anything there, our health aside and take care of others. My mother was the notorious one in our family for ignoring her own health, and she later had a heart attack. So yes, it's important to take time for yourself, even if you don't want to, even if you think you don't have the time, it's critical because, I mean, what is your family going to do if something happens to you and you're not there to take care of them? That's what I always tell my mother. So, and I tell myself. So yes, take care of yourself.
Thank you. So the next question is, does the outside temperature affect women with heart disease more than men?
I don't know about that, but I can tell you that I do tell any patient that you are very sensitive to temperature right after a cardiovascular event. Let's just say winter is coming and you had a myocardial infarction and a heart attack and had stents. You're more sensitive to heat changes. But all patients, whether they have any type of cardiovascular disease, you need to be taking care of yourself in extremes. I unfortunately can't answer that directly. Is there literature about men versus women? And I apologize about that. But anybody with these problems should be very careful in the extreme temperatures.
Great. All right. This next question could probably be for either of you. It says, I can't walk because of a back issue and I'm currently disabled. Is there a way that I can safely get some cardio exercise?
I would say definitely. I mean, they can design it for any difficulties that you have. I've been to cardiac rehab several times now with all of my health issues, and I love it. I always enjoying, and they do tailor it to your ability to exercise. So if you have issues walking, I'm sure there are other ways that they can help you with that. So all you need to do is just ask.
Yeah, and I would suggest swimming is a great way to exercise if your doctor says that it's okay.
Sure.
That takes the relief off of your back and your feet. You don't have to put that weight on your legs. And so that's another great way to get some exercise in.
Absolutely, Andrea. Even if it's just walking in a pool, even if it's a backyard pool, walking is exercise.
Great. Okay, so I think the next question says I am about 40 to 50 pounds overweight. Is it too risky to try to lose weight fast by going on a diet such as keto for a month to try and get my weight down, even though that diet doesn't appear generally heart healthy? I really need to get a jump start to lose about 25 to 30% of my weight.
I very much struggle with this on a daily basis. As mentioned, I have a strong interest in preventive cardiology, and I also run a lipid clinic, which is a cholesterol clinic. And I can't tell you how many people have come to the clinic with disastrous sequelae from being on that keto diet. What I can tell you is slow and steady wins the race. If you lose 3 pounds a week or 7 pounds in 1 month, statistically by research, you will keep that off. The American College of Cardiology has a source there for patients called CardioSource, which gives you information on some very heart-healthy basic diets. And I would strongly recommend that, and keep it simple if you want to start that way, by having the 3 meals where half the plate is fruits and vegetables, a quarter is a starch, and a quarter is a protein. Eliminating sugary drinks, eliminating sugar, cutting down on sodium. And some of those slides earlier for it recommended if you want to lose weight, you need to get some extra exercise involved if you can, and that way you can achieve that. I do tell my patients that if you are unsuccessful with 2 different diets, it may be time for you to join one of the medical centers. They usually have a GI nutrition program, especially if you have other comorbidities such as a cholesterol problem, high blood pressure, cardiovascular disease, sleep apnea. They certainly are a multidisciplinary group that can help you. It takes a lot of courage. It takes a lot of hard work to lose 40 to 50 pounds. And quite often, people will need support. I am not a perpetuator of the keto diet at all because I see what it does to people's cholesterol panels.
Great, thank you very much. Okay, so we have a question. Linda has her hand raised, and I am going to unmute Linda and see, Linda, I will give you the ability to ask your question. You should be unmuted now. Oh, I think you muted yourself, Linda. You want to unmute yourself? Okay, well, while we are working on that, I will give one. Oh, yep, we're here. Hi, Linda.
Hi. No, actually, I did that before I figured out how to do the drop-down box to ask a question. So it's already answered. Thank you.
Oh, great. Thank you. Okay, so I will give one last announcement that if you have any questions that you would like to ask, you can ask them in the chat box, or you can raise your hand and I can unmute you. We did get one more question that just came in. It says, are there any genetic tests that women can have that can precipitate their heart health in the future?
Absolutely. Precision medicine is what it's called with genetic testing. The institution I work for has its own genomic center, and we're currently studying 250,000 patients within our health system. And there's 27 targeted diagnoses. For myself in my practice, familial hypercholesterolemia is one of the targeted diagnoses, which means the normal pathway to metabolize a piece of cheese, the receptors, is something mutant that has passed through the families. For instance, my one patient I've been taking care of since he was 23, his grandfather died at age 42 of an acute myocardial infarction, an acute heart attack, sudden death, non-smoker. His father was 35, had open heart surgery, and one of the vessels to his neck, carotid artery surgery. He was a non-smoker, good body weight, not obese, not diabetic. And Steve, when he came to me, was already on 3 medicines, and his LDL, lousy lethal cholesterol, was 380 on the medicines. He is now on shots that were approved by the FDA in our country 3 years ago, and his LDL is now 70 to 100. This can be picked up on genetic testing. Through this, I've had several people come. I had a 20-year-old that's a student in college that was picked up on, that he's being treated aggressively with cholesterol medicine, and his father and 2 brothers are now my patients. Also through genetic testing, they can look for things such as prolonged QT syndrome. What that means is there is a problem with the electricity that you're inherited, and quite often we see sudden death, and that can be picked up early on. Other things include a particular type of cardiomyopathy called HOCM, which is genetic, where the heart muscle gets thick. And when you hear of a thick muscle, you think it's stronger. That's not the case. But people also die suddenly from that. And we now have some markers for that also. Precision medicine is the wave of the future. Probably after I'm gone, in the next generation, you will probably have a blood test probably around age 8, and they will have more factors that they can look for through genetics. Right now, it's costly. Some insurance companies, I mentioned those shots early for the cholesterol that Donnette's on. Some insurance companies want the genetic testing before they'll approve it. So you will see this evolve, especially in the next generation or so to come, but it is here and it is here to stay, and that was a very good question.
Great, thank you very much. Well, I think that we are at the end of our presentation. I would like to again thank the sponsor Amgen Cardiovascular for the educational grant that has made these webinars possible, the American Society for Preventive Cardiology for working with us on the presentations and the content for these webinars, and also to Caroline and Donnette. Thank you also very much for joining us today. I did get one last question, if you wouldn't mind answering it. It says, I've always had very high total cholesterol, but most of it's good cholesterol and the bad cholesterol is low. My health provider has always told me this is fine. Do you agree or disagree?
First of all, the HDL, which is the high healthy cholesterol, yes. The higher that is, the better. And that throws off, when you have a total cholesterol, it adds all of the three pieces up, the triglyceride, the HDL, and the LDL, the lousy lethal, together to give a total number. The higher, the better. There are some rare circumstances where the HDL is greater than 110. That's a genetic problem, and your provider should be alert to something like that. But if my particular one is 72, that's my HDL, and that's good. Remember what I was telling you earlier on that one page there. Your lousy lethal LDL cholesterol should be around 100 if you do not have cardiovascular disease. If you have cardiovascular disease or a genetic problem, it will be lower. 70 or lower will be your goal. So as long as you keep that LDL around 100 or less, and your triglycerides that come from everything we know and love, cookies, candies, baked goods, pasta, booze, if they're 150, around 150, that's good. The more you have, you got more on your defense side of getting the bad cholesterol back to the liver for processing. I would ask you to really get your provider to explain your particular numbers to you, but I hope that was helpful in answering your question.
Great, thank you very much. And that concludes our webinar series for today. Thank you all for joining us, and I hope that you join us in 2 weeks for our next and final webinar in the series. Thank you and have a great day.